Hi everyone, I am Dr. Affy, joined by Dr. Tara Hall. We thought it would be appropriate to do a little Q&A session so you can get to know her as well as I know her. I want you all to be so excited to come in and meet her if you haven't. She's absolutely amazing. So let's start off with just a basic, tell us about Tara Hall. What are some fun facts you want people to know?
Fun facts. Okay, so I'm actually not even from California. I'm from Boise, Idaho. So moving here has been a change.
Yeah.
But I really love California. Fell in love with it when I came to school here.
Okay.
So I plan to stick around.
I love it. Did you move straight to the LA area?
Yeah,
Okay.
yeah. So I moved into La Mirada, which is right next to campus, and I'm
Okay.
still living there. And
I love
my house. So yeah.
The Chiro roommates.
Yes.
And then what got you into chiropractic? When did you know that you wanted to be a chiropractor?
So my father actually was a chiropractor when I was younger.
Okay.
So we grew up, always getting adjusted. All my family's been very athletic, so injuries through sports, and we're like, oh, Dad,
Help
take care
me.
of us. Exactly. And just also with the mindset of, there's simple ways that your body can heal itself. We don't always have to resort to the Western medicine and things. So just growing up, I thought that's how everyone thought.
I love that.
Which is cool, but then going to chiropractic school, I learned so much. Just growing up that people resort to over-the-counter medication instead of an adjustment, or little things like that. But yeah, so fell in love, or I thought I always wanted to go into chiropractic school, kind of follow my dad's shoes.
Yes.
And then when I got into school, fell in love with it and realized oh wow, this is exactly what I want to do with my life. Yeah,
I love that.
Yeah.
So then what did you go to college for?
So my degree was actually in biology and chemistry, minor in chemistry, which was kind of, sometimes I felt like going into school, oh my gosh, what did I do to myself? Why didn't I take kinesiology?
Why?
But I really, I was in undergrad, I really felt I was a part-time or a full-time athlete.
Okay.
So I played volleyball. I went to a junior college in Wyoming.
Okay.
And then I got a scholarship there.
I love it.
And then a scholarship in South Dakota.
You're used to the cold.
I know. Oh man, it was so cold over there. But yeah, it was a great experience. I really learned a lot about juggling a full-time athletic job, and I had a part-time job and school, so it was a lot on my plate, but it really made it easier getting into chiropractic school because I already knew how to juggle so many things at once. So
good for you.
Plus, like I mentioned before to you, that's kind of where I learned I loved working with athletes, being around athletes all the time. I just understanding the grind and wanting to commit to a sport and the competitiveness.
Yeah.
So yeah.
I know it's hard to get that after college,
I know, I've been kind of missing it, so I'm trying to find things. Yeah, right?
I love it. Okay, so what would be your ideal patient? Who do you love to treat?
I don't love, I don't want to say I only like treating one person, because there's people from all walks of life that I thought I was going to like this one type of population, but then I found that it wasn't necessarily people who do this certain thing, but more so people who are committed to the treatment that I'm giving them, right? I give them homework to work on, they come back
do it.
and they've done their homework. It's beautiful because then we can keep progressing in their care, and we don't have to oh, you didn't do it, so I don't know if it was effective or where to go
You're
from
we
there.
can actually get you better.
Yeah, and I love seeing the results and people who are determined to get pain-free and healthy and well. So,
I love that.
Yeah.
Cool. Okay, so what about any specialty courses that you took while you were in school, or maybe certifications, or just anything cool that you're interested in studying, anything like that?
So in school, I graduated with 3 certificates. I got my sports medicine certificate, which, furthered my understanding with sports and how to treat athletes.
The culture of it all.
Yeah, I also got my functional medicine certificate, which my aunt is a chiropractor in Irvine, and she does functional medicine. So I've worked in her office a lot, and I've really seen the benefits of functional medicine. So I kind of dabble in that. So I like to.
Would you mind saying what functional medicine is in layman's terms?
Yeah, for those of you that don't know what functional medicine is, it's basically taking someone and treating their some like my aunt's clinic, she focuses in diabetes or thyroid or cognitive decline.
Yeah.
And you do some lab testing, figure out like what might like deficiencies they had. Goodness, like anemia or all these things that might be contributing to their wellness, and you prescribe like supplements or vitamins and nutrients.
So cool.
And it's amazing to see like the transition people
It's
have.
like the other side of the spectrum of
Exactly.
like Western medicine
Yeah.
and over the counter
Like people
stuff.
coming in saying, "Oh, I have diabetes, and my doctor says I have to be on metformin for the rest of my life," and she's like, "No, like watch this simple like change in your diet and nutrition, and they can reverse their diabetes." Like
Love
it's
it.
crazy. So
Okay, cool.
dabbled in that.
Okay.
My other certificate was in advanced imaging. So I really liked our radiology classes in school. I don't know.
I did not, by the way. Those were like my worst
Oh, really?
classes.
Oh, that's funny. So I like kind of come in the background of like art. Like I like to paint and stuff.
Oh,
so like
yeah.
the visual, I don't know. I just
Okay.
really like, I loved radiology. Then I started getting into the MRI and
Is that my phone or yours?
oh my goodness.
Oh, the
I
camera.
don't have my volume on. That's so weird.
This brief intermission was brought to you by
Apple.
yeah, Apple calling me back.
Like radiology and MRI.
Okay.
So I got that certificate. I've
Love
also
it.
done some courses in DNS
Okay.
and some functional medicine courses. MPI is the type of style of adjustment I like to use.
Okay.
I've followed like fascial manipulation, neurodynamics, all similar things
So
to what Dr. Affy uses. So that's why
Yeah.
we go so well together. Very
Yes.
similar treatment styles.
Yes.
So.
I was gonna also ask, like, if somebody were to come in, what can they expect as far as treatment goes
Yeah.
in here? Like, how would you describe the way you treat?
Right. So if you've been in with Dr. Affy, very similar to her, I like to obviously do a very thorough exam, give you the best diagnosis we can, and then get into some movements or positions that relieve your pain. That way you have the autonomy over your own pain, and you can do these things at home and feel better without my help. But then once we found those things, also help you feel better with like the adjustment, making sure your joints are moving well, your nervous system's woken up, and that also affects the movement we're doing, and then some soft tissue to relax tight muscles, or some fascial work to help with that muscle tension, and then back as soon as we can get you to some more strength and movement, so that you're progressing into better biomechanic patterns and
Love it.
yeah, so very similar to Dr. Affy.
Yes. Not gonna be a shock, right?
Right.
So we're incredibly excited to just have you here, and I feel like you're such a good fit. I've already had a lot of people tell me that, like, she's very similar to you. It's a good match. And I'm like, awesome.
Yay.
So yeah, we want it to be an easy transition. Align Movement is growing and expanding, and it's not a negative thing that I'm going away. It's a great thing because my family's growing, and that means Align Movement's growing. And so we're really happy just to have Dr. Tara here.
That was something I wanted to add is that being here the last couple weeks, I've met a lot of her patients, and it really does feel like one big family. Everyone's so welcoming to me and accepting of me just like stepping in and helping. So it's like I'm very blessed to be a part of your family.
I love it.
Thank you for having me.
We're so excited. All right, if you guys have any questions that you want to ask Dr. Tara or me, go ahead and leave them in the comments below.